Hi, my name is Susan Cheney, and I first met Dr. Daiter in 1998 when I was Susan Finelli. I was not married. I was 31 years old, and I knew I always wanted to have children. And I was having some difficulty with my cycle, and I found that a lot of the doctors that I had gone to in the past relegated those problems and issues to being more in my head than being physical problems. The first time I met Dr. Daiter, he sat me down and we spoke for quite some time about that. And he really looked at me like I was a real person and a whole person, and he took everything into consideration about me before he did anything. He took blood work, he diagnosed that, he did an exam, he put together a profile of who I was and what I wanted, and a plan for me and for us to work as doctor and patient. And I had never had that before, because you just kind of go in the doctor's office and you forget the questions you want to ask, and then you're examined, and then you pay your bill and you go out. And I found that Dr. Daiter never has done that to me. And I've known him for 15 years. In 1999, I got married and I became pregnant, not through IVF, but he had removed in 1998 two large fibroids from my uterus, and then had to rebuild the uterus through a laparoscopic procedure. And that's what enabled me to have my son. And he's 13 years old, and I have Dr. Daiter to thank for that. So I have one child. I never decided to go the IVF route. However, Dr. Daiter never once shooed me to a regular OBGYN just because I wasn't going to use his expertise or his I don't know how to explain it. His methodologies. He always, anytime I had any issue, after I had my son, I've had a few miscarriages. I've had 5 laparoscopic procedures through Dr. Daiter, possibly 6. I kind of lost count. Where he would do a clean out, and then I'd be good for 2 or 3 years, and then I would start to have issues again, and I would come back again, and he always took it very seriously. And although he's a very lighthearted gentleman and funny, I feel like he was sent to me. So I think that if you're listening to this and you're single and you want to have children at some point, that he would be a perfect person for you to come and consult with. He will sit with you and listen to whatever you have to say with a waiting room full of people. And he'll do whatever it takes to learn about what your condition is and figure out how to remedy it. So I think that that's one of the most important things about Dr. Daiter is being a long-term patient of his. I went from Finelli to Cheney. I had my son not through IVF, and I decided not to go the IVF route. However, he never stopped treating me as a whole person, and I think that's important to find in a doctor.